Hi everyone, it's Dr. Jen on Ask Dr. Jen on Wednesdays. So excited to be with you today. Today I'm going to talk about baby skin and baby skin rashes, what to do, when to worry, when you need to go to the pediatrician. So everything you need to know about caring for your baby and their skin. So that's what's up today. Just to give a little bit of background, I'm Dr. Jen Trachtenberg, pediatrician. I'm an assistant clinical professor of pediatrics at the Icahn School of Medicine in Manhattan, and I have a private practice on the Upper East Side, taking care of kids from newborns through young adulthood. And I'm the author of 2 books, Good Kids, Bad Habits, and The Smart Parent's Guide to Getting Your Kids Through Checkups, Illnesses, and Accidents. And I've launched my new pediatric parenting series. It's a huge comprehensive video guide for parents, broken up into small bite-sized 5-minute videos, so you can have everything you need to know about caring for your baby while you're on the go 24/7, when you're feeding your baby, when your baby is sleeping. If you have a question, you can just look it up and I'll have the answers right for you. It's like having your pediatrician in your pocket. So go to my website, drjen.com, to find out more about pediatrician in your pocket. But today we're going to talk about baby skin and skin issues, because it's a common question that I get asked by many parents, often concerned if they see any blemishes or any rashes. They don't really know when it's an emergency or if anything needs to be done. So let's just jump right in. So one thing, when the baby's first at the hospital, your doctor will see the baby and inspect the baby from head to toe, looking for sometimes any bruising that may occur, and they may have bruising if they had a vaginal delivery, or even particularly forceps. They can get bruising on the side of their head, and the doctor will check to make sure there's nothing underlying, that there's any issues. But it can be like a red mark, or it may even turn purpley and yellow, and then will just fade away, so nothing to worry about. But there is something else at birth that actually looks like a bruise, but it's not. It's called a Mongolian spot, and parents often get concerned. It's usually right at the base of the back, right near the buttocks, right in the base there, near their cute little butts. And it looks like a bruise, but it's not. It's called a Mongolian spot, and actually fades away and gets lighter with age. And it's very common, often seen in dark-skinned individuals or Asian as well too. But again, nothing to really worry about. But I always do point it out to parents because it looks like a bruise. They may have think the baby fell when it was in somebody else's care, so it's important to know about the Mongolian spot. Other things that babies have, something called Erythema Toxicom. So Erythema Toxicom, it's got a long name, right? It's kind of scary sounding, but it's a rash that I'd say almost a third of babies have. They may develop it after the second or third day or so, so parents don't see it at birth, and then the next day they get all freaked out or panicked because they have this rash, kind of like blotchy red rash, mainly focused on the chest area, and it has sort of like a little center to it as well too. And it's nothing dangerous. Your pediatrician will probably point it out to you. I usually point it out to the moms because it can get a little bit worse before it gets better. But there's nothing to do for it. It's benign, and it's called Erythema Toxicom if you hear that name. Other things, the baby's skin. So also when babies are born, oftentimes their skin is very dry and peeling and flaky. And this is normal. Often as babies are at term, or what we call post-dates after 40 weeks, their skin can be more peely. And again, nothing to really worry about that. It usually just peels off itself, and then the underlying skin is perfectly fine, soft like a baby, and you don't really need to do much, particularly for that. That will just get better on its own. But people are always asking me, do I need to moisturize the baby? So in general, you don't have to, but most people like to do it. They like to give the babies a bath, and it's fine to do that. If you do give a baby a bath, you always want to use a gentle cleanser, and then you also do want to moisturize to lock in the moisture of the baby too. But getting a little off topic, so we'll talk about that in a minute. Just let's go back to rashes and stuff too. So other rashes that you may see at birth too would be something called Milia, right? So babies get these little white bumps sometimes on their nose, and they're just sort of like clogged pores, even though they're their babies. That happens. And again, that will just go away. You don't need to do anything. You don't need to scrub. Don't try to pop them. But these little white dots, they will go away. They're called milia on the baby's skin. There's also something called salmon patches, or I know parents often call them stork bites, angel kisses. Sometimes they get like a little red mark over here at the back of the neck. That's why it's called a stork bite, where the stork brought the baby. And it's flat, sometimes like irregular shaped. And it's not dangerous, usually just from blood vessels, and it actually fades away over time. Nothing to do about it. Sometimes when the baby cries, it looks more intense. Sometimes the ones in the back of the neck don't go away all the way, but they fade to very light, and usually the hair is there. You don't even see them, but it's nothing dangerous, nothing to worry about. Many, many babies have those as well. So they also, on their forehead or in between their eyes, on the nose area is a common place for those stork bites as well too. Jaundice. So at birth, sometimes babies are jaundiced. So that's not a rash, but it's something that you see. Jaundice means that they have that yellow appearance. And that can be caused by many different things. And your doctor, if your baby is jaundiced, will take a history and look at the blood types. It's often common that if mom and baby have different blood types, then the baby may get jaundice depending on the difference in blood types and the different antibodies. The jaundice comes from the blood cells sort of bursting or popping open, and then the bilirubin comes out and it's able to be seen and circulates through the bloodstream, and then the baby looks yellow. So the yellow color in and of itself isn't dangerous. What can be dangerous is the bilirubin can pass from into the blood and into the brain, and that's when it's dangerous. So that's why they're always checking. If they're concerned about bilirubin, they may be checking it with a probe or even checking it through a blood test, and it all depends on many, many factors. The size of the baby, the age of the baby, how well the baby is feeding, as I said, the blood type. And there are, again, other reasons why babies can become jaundiced too. It could be from dehydration, it could be from breastfeeding, it can even be other metabolic issues or even from liver issues too. So it's important, if your baby is yellow or you're concerned, have it checked out with your pediatrician. They'll probably want to follow it until the blood bilirubin level comes down to a safe level. Also, baby acne. So oftentimes baby have acne, and people are, how do they have acne? Only teenagers should have acne. But babies can have acne too. It's usually due to all the hormones from mom, from pregnancy, and that causes the skin to break out. Little red bumps all over, just like when adolescents get acne too. But this acne goes away on its own. There isn't really much that you need to do. Just keep it nice and clean, and it will go away on itself. I know it's hard because you want all these baby pictures, but it will go away, and there's nothing to worry about. There's also no correlation either between having acne as a baby and having acne as a teenager. So don't worry if your baby has acne. My first one had it too. I remember that, and with all my hormones, oh no, my skin, but it all cleared up and it looks beautiful, and nothing to worry about. So don't get too worked up over baby acne. It will go away. Other rashes, cradle cap is a really common one too. So seborrhea is really the name for it, but cradle cap, they often, again, don't have it right away either. Usually in the first month to 2 months, it's like very flaky on the scalp. It can be even some greasy patches, plaques we call them, that can get really thick over time. So speak to your pediatrician. There are different ways depending on what it looks like. It also could affect the eyebrows as well. It can get some whiteness there as well too, which then can cause a little bit of a red rash on the face too. So what can you do for it? So as I said, it usually goes away on its own, but parents like if you can do something to try to do something. So you can use different types of oil, and you can really rub it in to their scalp. You want to use a fine-tooth comb and really try to get out the flakes. I always tell parents to do like a massage with their fingers first and rub it really in, and then try to comb it out, and then wash the hair with a gentle cleanser. That often does the trick, and it can be really, really helpful. If not, speak to your pediatrician. Sometimes there's other things. There may be antifungal shampoos that may be necessary. Sometimes there's steroid lotions that may be necessary, but it depends. Each one is different and depends on how bad it is. But seborrhea is something that usually goes away after a few months or so. So don't panic too much over that. But again, concerns, speak with your pediatrician. Prickly heat is another rash that babies often get. It could be on their chest and really in the neck, like lots of little red bumps and stuff all over their chest and neck. And that's really from overheating. And why does that happen? Well, we always think little babies and they can't control their temperature that well, so we bundle them, but we overbundle them, right, as parents, and we keep the temperature so warm in the house, and that's not really necessary. Babies should just be really the same temperature you are, but then have they're okay to be in the same temperature as you are in your house. Somewhere around 70 degrees is kind of pretty perfect. And then you just have like one extra layer, so an extra blanket would be fine. But you don't want blanket upon blanket and again covering them and putting socks and long pajamas and just layers and layers. Sometimes I see patients come into the office with layers and layers, and then they're sweaty and they're hot, and they can, one, be uncomfortable, but two, it can cause like a prickly heat rash. And what do you need to do for that? Basically cool the baby. So take off all the layers, let it open to air. A fan can be good too. And then it's really just preventative going forward. The rash will go away, but you want to make sure that you don't want to do too many layers to make the baby uncomfortable or for them to have a heat rash. Also, babies can get eczema. So some babies may be more prone than others. It is hereditary eczema, and it's usually like dry patches on the skin that can be very itchy and uncomfortable. Babies who have eczema are more likely also to have allergies and asthma as well too. But eczema, as I said, it usually looks different in kids. It could be on their face, on their chest, and their back, on their trunk area. But more classically, as kids get older, eczema is more on the inside of the wrists, behind the knees, in the folds, and it's usually bilateral on both sides of the body, not just one. And again, prevention for eczema is key. So you want to keep the skin nice and clean, but again, you want to use a very gentle cleanser. On babies in general, you never want to use soap. Anything that says soap, you don't want to use. You want to use a very, very mild, gentle cleanser, hypoallergenic, not lots of smells and synthetic fragrances. You want to keep it pretty plain, but you also want it to be very, very gentle. Usually things that are like head to toe are totally fine to use. That usually maybe no more tears. You can use that on their hair, on their body as well too. And then when you give them a bath, you want to obviously make sure it's not too cold, but you want to make sure it's not too warm either. And this will is better for the body, because if it's too warm, that can dry out the skin. It is okay to bathe babies, as well as okay to bathe babies that may have skin issues like eczema, but you do want to make sure that you then moisturize afterwards. That will help the skin and to lock in the moisture as well too. So while the skin is still a little damp, you want to put on the moisturizer. Again, I think a hypoallergenic one is the way to go. You don't want, if they have sensitive skin, to use anything with lots of fragrances or artificial colors or things like that too. So that's usually, again, all you need. But if it is the skin is really bad, then check with your pediatrician. They may need to have a prescription cream, or maybe even a steroid cream for a certain period of time. Sometimes when eczema gets really bad and kids are scratching, even little kids, that can get infected, so they may need an antibiotic as well too. So any rash, or if they have eczema and they're having a bad flare, then you want to make sure to speak with your pediatrician as well. What else can help? So overheating can make eczema worse. Obviously when they're sick, it can make their eczema worse. You want to keep their nails nice and short. And again, use a detergent that's hypoallergenic. That can help too if they have very sensitive skin. So all those things can help. It's really about keeping skin healthy and preventing the outbreaks and the relapses, and when you have them, to really treat them till they go away, and then continue on with moisturizing to keep it hopefully from coming back too soon. Another rash that kids can get is fungal infections. And so they can get fungal infections or candida rash in their mouth. That usually looks like white. And so I've often had parents concerned that their baby has thrush, and it isn't thrush, it's actually just milk, so formula left over. So it's important to always clean the tongue. Every day you want to clean the mouth out with a gauze pad or a wet washcloth, and then also you want to clean the tongue. People forget that all the time, but it's super important to clean your baby's tongue. If you're seeing that it won't rub off at all, or they have spots on their mouth, then that may be thrush. Sometimes babies have problems feeding if they have thrush. If they do, or there's any issues, or they're not feeding at all, important to always speak with your pediatrician to really have that diagnosis and see if they do need treatment as well. You may need to get new nipples as well for the bottles. If you're breastfeeding and you have thrush on your on you, then you may need to be treated as well too, so you don't keep giving it back and forth to the baby as well too. So any concerns about thrush, speak to your baby, speak to your pediatrician about your baby, and they can also help you too if you're having an issue with the breastfeeding. Also, you can get Other places you can get yeast infections too. In the diaper area is really common. Diaper rash, again, is a really common rash that babies get, and yeast infection is one of the most common ones. It's usually very bright red, angry looking, with lots of little spots as well too, little red spots over, and sometimes it'd be painful to babies, sometimes not. It's just a very moist area. It does not mean you're not a good mom if your baby gets a diaper rash. You can change the diaper over and over, and sometimes it still happens from the moisture, from when they're pooping, from the acidity, the pH in the stool too. But what I recommend, first of all, is to helpfully prevent diaper rashes, and so to use a barrier, a cream with each diaper change, and that will help to prevent the rash in the first place. If you do get a very bad diaper rash, then you usually need, and it's a fungal, and you've confirmed that it's a fungal rash, then an antifungal cream. And many of them now are over the counter. So you can use an antifungal cream 3 times a day, and that usually does the trick. You want to make sure if they have bad rashes, I like to tell my patients to avoid using wipes, just because they can have alcohol in them, or they can have other synthetic ingredients that can be bothersome to the rash. So just using either a washcloth and some water, and then just wait for it to dry, and then put on the cream. And one of the things is you want to really put on diaper cream to prevent any type of rash, really thick, and that's one of the problems that parents have. They just put a little bit on, they're scared to put on. You want to pretend you're icing a cake. That's what I tell my patients, icing a cake. You really want to get that all over and make sure that it's nice and thick, and that will help protect, because then it's a barrier. So you want to use those barrier creams. And when they don't have a fungal rash, the other type of rash that they may have is called a contact rash, and that's just contact, again, from stool or from poop, from urine, or from being moisture and wet. So that's when you want to use a cream like a zinc oxide, and that's just a good barrier cream. And the higher the percentage, you have to look at the active ingredients, but the higher the percentage, the thicker it is, and the more protection you're going to get. So you want that really thick paste cream to put on if your baby is prone to diaper rashes. It will help prevent it. Or if they have like contact just from wearing the diaper, you can use those over-the-counter creams. They really do work well. So those are the most common rashes that I see in babies. And again, none of those are really anything to be concerned about. It's good to learn about them, to know what to do. But when should you worry? What kind of rashes? So if a rash looks like pustules, or really pussy or blistery, more cause for concern. If they're like yellow or goldy color, also have your pediatrician look at it. You want to make sure there is no infection, a staph infection. If there's anything that looks like little blisters, it could also be herpes, which in a baby can be very emergent. So that's important to always bring that to your pediatrician's attention. Again, if they're having a rash and a fever, so important to always tell your pediatrician. And lastly, if they have a rash that's like purpley dots, purple is the key word, not red, but purple dots that when you touch them, they don't, I call, in medical literature, we call blanching. So if you touch it and it goes away, that's often a sign that it's okay. But if it is a purple rash that when you're touching it and you still see it and you can't get it to like fade and then pop back to the color, that's more dangerous. That can be a sign of a serious infection that needs to be treated right away. So if your baby is sick or has fever or has a rash that you don't know or you're not sure about, always err on the safe side and speak with your pediatrician. So I hope that was helpful, talking about those common rashes in the newborn period. Send me any questions if there's any other rashes that your child had that I did not go over today. I'd love to talk more about it in the comments below. If you want more information or you want to have this at hand at all times, knowing about your baby's skin, because it is the biggest organ in their body, as well as their heart, their lungs, what to do to feed them, sleeping questions, how to get them to sleep, bedtime routines for kids, more parenting information, developmental milestones, what to do, what to look out for, you name it. It is all there in Pediatrician in Your Pocket, your guide, a video guide from me, giving you all that information when you need it most to keep you from getting stressed and to decrease your anxiety level, because you're going to have all that evidence-based information coming from me that you can trust, that you can use when you need it. Pediatrician in Your Pocket. go to my website, drjen.com, to find out more information about downloading it to your phone so you'll be ready 24/7. It's Dr. Jen, and I'll speak to you guys soon. Have a great day.